Maria, if you already go ahead and share your screen, that would be great. If you need, 1 second, just a little, uh, there we go. All right, so this is our summer training. We'll be discussing extreme heat and how you can stay safe and protected this summer. We have interpretation available in Spanish. If you would like to access this interpretation, I will show you how to do that on the next screen. Thank you to Cornell, our Spanish interpreter today. We are very thankful that you could join us. The interpretation can be located on the little globe down at the bottom of the screen, and then you can click to go into the Spanish room to hear the interpretation. If you have any questions, feel free to chat us if you have any difficulties. This training will be recorded and posted to our YouTube channel, YouTube page, so that anyone who couldn't attend can still get the information. So definitely please share that information with anyone you know who was willing or wanting to join this training. Throughout the Throughout the session, we will be answering any questions. You can use the Q&A box to ask any questions that you have. Any questions that are easy enough to answer, my colleague will be answering them directly in the Q&A session. If there's something that I can answer while we do throughout the training or at the end of the training, then I will do that as necessary. If you're calling in, your question is not answered, you can still call us and ask your questions at 215-685-5488. Thank you to our colleagues at the health department that are here to answer any and all questions. Today's training is specifically geared towards the trusted messengers, the people who look out and provide information to their people in their communities and their families and are trusted messengers for them. The trusted messenger in your life could be a family member, friend, healthcare provider, community leader, social worker, or even a teacher. There are many ways that trusted messengers are important. You deliver accurate information, provide resources, communicate with cultural humility and competence to your community members, and provide a safe space for your community members to share their requests, needs, and questions. This list is non-exhaustive. There are many ways that trusted messengers are a pillar in their communities, and we appreciate each and every one of you for being that for the people in your community. Today, we will discuss extreme heat. This is training. After the training, you'll be able to identify a number of things, including city resources to help yourself and your clients, like cooling centers, public pools, and other free programs, public health risk of extreme heat, why it's important to stay safe, and any signs and symptoms of risk factors for heat-related illness and how they are contributed to chronic health conditions. First up, we want to see your answers in the chat for some of your favorite summer activities to do when it's warm and hot out. Yes, eat ice cream, go to the beach. Yes, those are definitely some fun activities to do during the summertime. Spending time in the park with friends and family, perfect. So while we all have our different activities that we enjoy in the summertime, you still want to be able to stay safe. So we'll talk a little bit about that. First up, we will discuss extreme heat overview. So I will pass it over to Maria.
Thank you, Jasmine. So welcome everyone. I'm going to talk a little bit about extreme heat, go over some overview and some key takeaways, and then we'll go into some resources at the end of this so you could tie it all together. So, extreme heat is a period of high heat and humidity with temperatures above 90 degrees for at least 2 or 3 days. So, this can be very dangerous for pets and people. It can cause utility disruptions, cause severe storms, and it's occurring more often due to climate change. And you might hear about this more and more in the weather. So, public health risks. So, here we see that in 1992 through 2021, the average yearly 30-year average, sorry, you can see that there's heat, flooding, lightning, tornadoes, and hurricanes. And here we see that heat is the biggest public health risk right now. So, Philadelphia temperatures. So, historically, the average summer temperature was about 84.5. The number of days above 95 historically were three. And historically, there were 0 days above 100. So, I'm sure everyone notices that it's getting hotter and hotter, and these numbers are definitely increasing. So, what are some guesses for the future numbers for the average summer temperature? What do you guys think would be the future average temperature in Philadelphia? You can drop those in the chat. I'm unable to see the chat right now, so Jasmine, if you could, if you call out any numbers that folks are saying.
We have 89, 90, definitely some good
Some good
guesses.
guesses, yes.
95. Ooh, perfect.
Wow, great. So it's 91 through 96. So everyone was pretty dead on. So that's great. So the average temperature in December will be between 91 and 96, which we can all imagine is very hot. We feel those hot weather days already, and they're very uncomfortable. So for the average number of days above 95, historically was three. So what are your guesses for the future projection for this? So how many days over 95 degrees do you think we'll have in the future? Drop some in the chat. And Jasmine, if you could help me out with that again, that would be great. Thank you.
60, 30, 10, 56, 5 to
Okay.
7.
So we have 28 through 67 days. That is a huge jump from 3 days. So great guesses again. So then we have our 0 days of days above 100 degrees. So what is our scary future number for that? So how many days do you think it will be over 100 degrees in the future? You could drop your guesses in the chat again.
We have 15, 10.
Okay. So 7 to 31. So we see here that it ranges from about a week to about a month, which is very daunting considering that it started off with 0 as our average. So this is why we want to talk about extreme heat and all the health impacts that can affect priority populations in our city. So, did you know in the summer of 2024, so just last year, Philadelphia recorded 23 days of 90 plus degree weather. So, we see here that we're in the middle or close to our projection for our future 28 to 67. We have 23 already, so we could only imagine what it might be like even this summer. So, urban heat island. So, the urban heat island is very interesting because we see that the temperature in the city, so where we have a lot of buildings, less trees, we have this urban heat island effect. So, it's hotter. So, it's hotter here in the city, the commercial areas, the urban residential, in comparison to the suburban residential and the farmland, the park, for example. So, our city is very residential, so you could only imagine that we do have higher temperatures in the summer than our surrounding counties. So the heat vulnerability index, it combines the most important factors associated with negative health effects of extreme heat events. And this uses demographic and socioeconomic data, for example, education, poverty status, English proficiency, race, ethnicity, social isolation, older age, health status. We see a lot of the more common chronic conditions that folks face, especially in our city: asthma, obesity, diabetes, hypertension, heart disease, COPD. And then it also looks at environmental exposures. So daytime land surface temperature, nighttime land surface temperature. So you could imagine that once the sun goes down, the temperature is not so hot, and that changes the land surface temperature as well. So this looks at all of this to determine how vulnerable a population is when it's very hot and what impacts might happen. So here is a map of the heat vulnerability index. So this shows the areas in the city that are the hottest, with those areas being that dark red kind of maroon color, and then the coolest during the summer. So the cooler would be the very pale yellow. So the neighborhoods with high heat vulnerability include Cobbs Creek, Overbrook, Point Breeze, Strawberry Mansion, Hartranft, and Hunting Park. So when we look at these numbers, interestingly, we see that they overlap with other problems. So these are also our high risk areas for folks that, for example, have heart disease or asthma. So this kind of, it all overlays with each other. So if we put those maps over each other, we would see these same areas over and over again. So we want to prioritize these neighborhoods because we know that these folks might have worse health outcomes than the other areas. And if you visit this link down here, this bit.ly, you can search your neighborhood on the map. So if you don't live in any of these neighborhoods and are curious to see, just take your camera, hover over this QR code and you can see, or you can just jot down this bit.ly. So it's bit.ly/PHL heat index, and you can search for your neighborhood. So here we have two images of two different neighborhoods. So what do you all notice is different between the two images? You can put your guesses and answers in the chat. And if we have any guesses in there, Jasmine, if you
We
could let me
have
know.
trees, more shade,
Yes.
shade in the bottom picture. Yep, trees and shade.
Perfect. So that means that our bottom picture is slightly cooler. So when it's very hot in the city, that top neighborhood will feel hotter than the bottom one. And this can go either by neighborhood or again surrounding counties. So it could go as far as like Montgomery County, for example, or we could be talking about Center City and North Central, just an example. So I'm going to turn it back to Jasmine, and she's going to talk about heat-related illness and all the signs and symptoms associated.
Thank you, Maria. Now that we've established that extreme heat is increasingly common in Philadelphia, we're going to talk about the public health concerns of extreme heat. Can anyone name in the chat any heat-related illnesses that they may know of? Sunstroke, yep. Fatigue, heat stroke, dehydration, yes. Some of these are symptoms of heat-related illness, which we'll go through. Yep, perfect. Sunburn, yes. Great, thank you so much. The first one that we will discuss is muscle cramps. Muscle cramps are sudden, sharp pains caused by dehydration or losing nutrients, and they can be the first sign of heat-related illnesses. You'll usually feel heavy sweating and painful muscle spasms, usually in the legs, and other muscles throughout the body. If this happens, you want to stop what you're doing immediately, move to a cool area, air-conditioned area, and drink cool water or electrolyte drinks like sports drinks. And don't return back to activity until the cramps are gone. If the cramps last more than an hour, or if you have heart problems, or even on a low sodium diet, this is when you might want to seek medical attention and get the advice of a medical professional to ensure that you are doing what is necessary to take care of yourself with muscle cramps. Next is heat exhaustion. Heat exhaustion happens when your body gets too hot too quickly and struggles to cool down. Usually, this is from being out in the hot weather without enough fluids. Some symptoms include heavy sweating, dizziness, fainting, and clammy skin. If you notice these symptoms, you want to stop what you're doing and rest in a cool, air conditioned area. Loosen any tight clothing that you might be wearing, sip on cool drinks and water, and maybe even use a cool towel on certain areas of your body, like your neck, armpits, to cool down, or even take a cool shower. If you're vomiting or if your symptoms don't get better in an hour, you might want to call 911 and seek medical attention. Heat stroke is the one that we really talk about in the summertime because it's the most serious heat related illness and it can be the most damaging. It can cause death or even permanent injury or disability without emergency treatment. This is a medical emergency when your body simply cannot control its temperature. Your temperature rises so quickly, you stop sweating, and your body just can't cool down. This can damage organs, including the brain, that leads to lack of blood flow. Calling 911 immediately is the first step to making sure that you're able to manage yourself or someone that might be expressing symptoms of heat stroke because it can be fatal. Symptoms include throbbing headache, hot and dry skin, confusion, and even passing out or unconsciousness. During heat stroke, you want to call 911 right away, like discussed. Move the person to an air conditioned space or cooler area. Help them lower their body temperature by putting a cool cloth on their neck, armpits, growing areas, or taking a cool bath. Those are the quickest ways for your body to regulate the heat quickly. Do not give the person anything to drink if they are unconscious. This is very important. You don't want them to choke or aspirate on any fluids that you might give them. If they are conscious and able to drink water, then you definitely want to make sure that you are giving this person something cool to drink, cool water to help regulate their body. The prevention for this is staying cool and hydrated. Sunburn is not one that most people take as seriously in the summertime. So this is what happens when you have too much sun exposure and the symptoms can take a few hours to show up after sun exposure and worsen over the next day. Your skin may feel hot, red, and painful. This happens because UV rays are stronger now due to the climate change that Maria spoke about. So protecting your skin is more important now than ever. You want to wear hat, sunglasses, apply SPF 30 minutes prior to when you're about to go outside into the sun and reapply as directed on the package. SPF 15 is or greater is what you want to try to use. And also looking for something that says broad spectrum or UVA, UVB protection on the label because those work best for that full coverage. Everyone should be using sunscreen all summer and even not in the summer if we really want to talk about it. No matter your skin tone, seeing a doctor if the burns are severe, cover large parts of your body, or even if you have a fever or really intense pain that doesn't get any better, is beneficial so that you can ensure that you're staying safe. In serious cases, sunburn can cause dehydration or even shock. This is because the skin pulls water from the body to the surface, and dehydration can look like fainting, shock from dehydration can look like fainting, low blood pressure, or even weakness. And at that point is when you want to seek medical attention and call 911. Heat rash is also known as prickly heat. This happens when the sweat is trapped under your sweat glands, under the skin, and usually causes the sweat ducts to become clogged. Is more common in hot and humid weather. and often shows up on the torso or thighs, and especially where skin touches skin. So those skin folds, like in between the groin, armpits, and things like that, elbow creases. If you get a heat rash, the most important thing is to keeping the area clean and dry. You don't want to apply any moisturizing lotions or ointments or creams. You can use baby powder to soothe the rash, but keeping it clean and dry is most important because ointments can make the rash worse. Prevention is key for that as well. So number one question that we have, we're going to be launching a poll. So a neighbor has been outside all day and is complaining about hot, red, or dry skin and a fast heartbeat or dizziness and even a headache. What would you do to help? And you can answer the question in the poll that's launched. That's the wrong poll. Um, or even drop your answers in the chat. Get them some air conditioning. Yes, Genevieve, that is a great number one step. Anything else? Alrighty. So some potential answers, get them to a cool location like air conditioning, get them inside and give them water, help them lower their body temperature, and also seek medical attention is a good step. I'll turn it back over to Maria for some key takeaways.
Thank you, Jasmine. So our key takeaway number one is that if you suspect that you or someone you are with is experiencing a heat-related illness, you want them to cool off, get help, and then call 911 immediately if you think it's an emergency. So just remember these steps, and we have this information in a lot of our heat resources, so you can always check those out as well. So populations most at risk. So exposure risks would be people who work outside. So like construction workers, athletes who exercise outside, people without a home, people without AC at work or at home. So you see here that this group doesn't have a way to cool down. Some social factors would be people who are homebound, people who live alone, and people experiencing homelessness. Biological factors, we have our priority populations here, older adults, so people over the age of 65, infants and children, pregnant people, and people with some chronic conditions. Again, we see asthma, heart disease, and diabetes like on the previous slide. So if you fit into these groups here, you're more at risk and you would benefit from taking precautions, prevention measures, and knowing all the signs and symptoms that Jasmine just went over. So checking in on those at risk. So if you're a caretaker or you have neighbors, family, and friends who are most at risk for heat-related illnesses, you want to check on them regularly. So you can easily just check in with them and see if they're drinking enough water. So a lot of people do not know that they're supposed to drink a lot of water on a regular basis, especially when it's very hot. Ask them if they have access to air conditioning. Ask them if they have a place to keep cool and they know how to keep cool. And ask them, do they know the signs and symptoms of heat-related illness? So if you have an extra brochure from the health department that has all this information, you can share it with your neighbors or your loved ones or household members. So again, the most important thing here we want you to know is that you should seek medical attention if there is concern for heat exhaustion or heat stroke. So key takeaway number two is prevention is key. So again, you want to drink plenty of water, sports drinks like Gatorade or fruit juice throughout the day. You want to avoid sugary drinks like sodas and juices and drinks with caffeine. So you might want to stay away from coffee. So, and you don't want to wait until you feel thirsty. You want to make sure you're drinking water throughout the day. Also, plan your day so you aren't spending too much time out in the sun or heat. So, if you have errands to run, or you want to go to the grocery store, or you have to wait for the bus to go to a senior center or anything like that, you want to make sure you're not doing it during the hours of 11 a.m. and 4 p.m. because that is when it's the most hot outside. Don't wait for an emergency if you start to feel overheated. So if you start feeling overheated, immediately go inside and find a cool place to go right away. Don't wait until it gets worse, and better safe than sorry. Prepare your home for hot days with utility assistance. Again, our program has some utility assistance brochures in many languages. You'll learn about those resources from King later in the session. And you can always call and see what you're eligible for. And you never know, you might be eligible for a program you didn't think you qualified for. So making sure that your home has ACs plugged up, working and ready. You have fans, you have some curtains. Blackout curtains are really good to have, and they're affordable, especially at Walmart. And supplies to stay cool. So making sure you have water. If you drink spring water, making sure you have enough of that at home so you don't have to go outside and buy any. And make sure someone knows to check on you if you live alone. So if you do live alone and maybe you have a little buddy system where a neighbor checks on you, you check on your neighbor, or even like a phone tree, you can call a few friends to make sure they're okay and they let someone else know that you're okay. And you all just, check in on each other that way. So we have a question here, and I'm going to launch a poll after to gather your answers. So it will be 91 degrees today, and you need to go grocery shopping, but you have to wait for SEPTA. What time should you go shopping? So it's going to be 91 degrees. So I'm going to launch a poll, and then you guys can answer that.
We have some answers in the chat as well. So after 4 p.m. and before 9, those are great answers.
Great answers, yes. That's great, great. So, and we do know that sometimes it can be a little difficult to plan things around a certain time frame because some things might be timed, like appointments and such. But these are just tips that you can remember and try to plan as best as you can around these dangerous hours of the day. And I will turn it back to Jasmine.
I was just informed that I was muted, so thank you. Sorry about that. As discussed, some chronic health conditions can be can make people more vulnerable to certain heat, illnesses, and negative impacts of extreme heat. So we'll go through that. Extreme heat can worsen pre-existing health conditions, including diabetes, cardiovascular disease, asthma, obesity, mental health conditions, like Maria was able to discuss. Those with chronic health conditions may be less likely to notice changes in temperature, which can result in a delayed response when seeking medical attention during the warmer months. They also may be taking medications, specifically those that affect blood flow and sweating, which includes some of the examples that was already put in the chat by Genevieve. So some mental health medications like Lexapro or antipsychotics and things like that. Um, certain diabetic medications, respiratory medications, and even kidney disease medications. So you want to be able to discuss those risk factors with your doctor. People taking medications for kidney disease, heart disease, and mental health conditions um, can have impaired sweating and impaired cooling mechanisms. Some medications, such as insulin, inhalers, and EpiPens, can also be damaged by direct impacts from hot temperatures and sun rays, so you want to make sure that you're keeping your medications safe and in proper care so that they are effective and don't become damaged. Although we have discussed that some medications can affect the extreme heat impacts, you still want to take your medications as prescribed and just have a conversation with your doctor to make sure that you can make a plan for any of your medications or any of these risk factors. Heat and obesity definitely impact one another. People who are overweight and obese retain heat more, and because the body and fat acts as insulation. This can affect the body's ability to cool itself effectively or quickly. Obesity is also a risk factor for many other conditions, which increases the chances of feeling sick due to heat. Mental health. People with some mental health conditions are at greater risk of worsening symptoms when the weather is extremely hot. This could include anxiety, irritability, difficulty concentrating, or even difficulty sleeping. Um, and this is 10 times fold if you already have a mental health condition. Worsening mental health can also further lead to the inability to take care of oneself during hot weather, which can make you more susceptible to heat related illnesses. Diabetes is another one. Diabetes can make it harder for your body to cool down because of damage to the nerves and blood vessels. That same damage can lead to reduced feeling in the feet. So, walking barefoot during the summer is a no-no. You don't want to do that. Even at the beach or the pool, it might seem not as intuitive to wear shoes during those fun summer activities. But if you have diabetes, you definitely want to make sure you're protecting your feet and skin because unnoticed injuries can lead to further complications for diabetic patients. Hot weather causes sweating, which can lead to dehydration. And for people with diabetes, that dehydration can raise the blood sugar and make things worse. Staying active is also an important management technique for diabetes. So if you have to be active during the summer, you want to maybe try to avoid exercising outdoors during the hottest parts of the day, 11 to 4, like we discussed, or just changing up your routine a little bit. Maybe um, instructing someone with diabetes to take their daily walk around at the mall instead of outdoors at the track or at the park if it's too hot out. Respiratory diseases can also be impacted by the heat as well. Hot weather increases ground level ozone, as we discussed with the increase in climate change. That is a pollutant that can irritate the lungs. Hot, humid air can also make it harder to breathe because the air is heavier, especially for those with um, already have respiratory diseases like asthma or COPD and even heart issues. Dehydration and imbalanced electrolytes due to the heat can also trigger asthma symptoms. You want to watch for worsening asthma symptoms or COPD symptoms that can indicate you're having a hard time during the warmer months. Heart and kidney disease. So heat can affect our heart and kidneys the same way. So to cool down, your body sends more blood to the skin, and this can put extra stress on your heart and the kidneys. So this can reduce blood flow to the kidneys and increase cardiac output for the heart, and that causes extra strain and make those organs work harder during the summer months. Exposure to hot temperatures can lead to dehydration, blood clots, and electro imbalances. Air quality also worsens with the heat, as we've discussed, and this can raise the impact of heart health, so raising risk for heart attacks, strokes, and even heart failure. If you have heart diseases or kidney disease, you also want to be on the lookout for fluid overload. This could look like extra swelling, abnormal swelling, trouble breathing, and even a frothy cough with sputum. And that can signal heat or heart and kidney stress. Just some quick tips for managing chronic health conditions in the extreme heat. So the number one thing is that you want to discuss your risk factors and make a plan with your healthcare provider. So encouraging people that you know that may suffer from these chronic conditions during the early summer months, right now while we're in May before it gets really, really hot, encouraging them to make a plan for when the temperatures do rise with their healthcare providers. You want to take medications as prescribed and keep medications safe and supplies cool, and have a backup plan in case there's any power loss due to storms or anything like that during the summer. Staying hydrated, so drinking plenty of liquids, even if you don't feel thirsty, it's important. Avoiding extreme heat, limiting your outdoor activity during the hottest part of the day, which is 11 to 4 again, and wearing loose and light colored clothing. Monitoring your health by checking for any worsening symptoms of chronic health conditions, and discussing those symptoms with your healthcare provider. Wearing sunscreen, a hat to prevent sunburn, which can be especially important for people with diabetes because pain and stress can raise the blood pressure. But even for someone without diabetes, just making sure that you are wearing sun protection. As we discussed before, SPF 15 or higher is the best way to go, and those broad spectrum labeled products. Stress management is also very important, especially as we discussed for mental health conditions. So making a plan to manage your stress throughout the hot temperatures can make sure that you're safe this summer. Now I'll pass it over to my colleague Keith to discuss how you can stay safe and cool with city resources this summer.
All right, so now I'm going to give you guys some tips and resources for how to stay cool this summer while navigating not while navigating through the city this summer. So to begin with, when temperatures begin to rise in Philadelphia, the city responds in three ways. The first one being heat caution. Basically, what happens here is this puts partners on standby to provide services and help to individuals who may need assistance. It also, yeah, for individuals who may need assistance. Then also we have the code red. Basically, what happens here, this is when we have the Office of Homelessness Services and the Department of Behavioral Health Intellectual Disability Services. They conduct 24-hour outreach to individuals who are unsheltered or without homes, and that also includes assistance for pets and animals also. And then the third thing that happens is the heat health emergency. Basically what happens here is it is the highest alert. It's called when heat gets dangerous, especially for vulnerable groups. The city looks at the heat index, which is how they determine which areas and who to make the calls to. Um, when that happens, a few other things may kick off. For example, the PCA heat line, which is the Philadelphia Corporation for Aging. They will have nurses on standby who can answer any heat-related questions. There will also be the mobile heat teams. So basically, these are individuals who respond to individuals who may need assistance during times of excessive heat. We have cooling centers, which are available for individuals. Cooling centers would be open. They're locations like museums, libraries, older adult centers, but they're open for an extended amount of time, which we'll talk about which we'll talk about in a couple more slides. And then utility shut-off stops. So basically just halting your utilities from being stopped. And just to stay up to date with all of these things, you can sign up for the Ready Philadelphia text, and you can text that to 888-777 to sign up for that. All right. So now we're going to talk about some cool tips for how to cool tips for while we're in our home for how to stay safe and cool. First and foremost, our first to go to would obviously be to use our air conditioning units as a first line of defense. But when we think about it, not everybody has access to actual air conditioning units. So our next alternative and next best practice would be to use a fan, right? Using a fan allows us to still receive cool air. Basically, how we would do that is we're just going to make sure we put that fan into our window sills, and that will allow the cold air from outside to then be pulled into our areas, whether it's our rooms, living rooms, kitchen, making that specific area cooler, right? But not every single day during summer, temperatures will be cooler outside versus inside. Half of those days or some of those days will have temperatures that are just as hot outside as it is on the inside, right? So using a fan in those type of situations wouldn't be beneficial to us because if we have temperatures outside that are 90 degrees and it's also hot in our apartments, we're then pulling hot air into our homes, and that's not benefiting us at all. So some alternatives that we can do would be making sure we spend some time in the lower levels of our homes. Within my family house, we have 4 levels in a backyard, with the basement always being the coolest area. So I always spend a lot of time in the basement or in the backyard by the pool, because these two areas are, I can either get in the water for the pool or I can just be in the basement where it is the coolest. And it's the complete opposite for wintertime. I avoid those two places. Making sure we close windows, making sure our curtains are closed and our blinds are closed during the day, especially from 11 to 4, because that's when the sun is at its peak, can allow the rays from the sun entering, it can stop the rays from the sun from entering our homes, thus making it cooler in our general vicinity. And just avoid using an oven or stove during very hot weather. Why? Because if it's already hot outside, we don't then want to be cooking, which is going to bring more heat into our homes. All right. So now we're going to talk about some ways that we can stay cool this summer. First one being cooling centers. Like I previously mentioned, cooling centers are air-conditioned spaces open late during times of heat health emergencies. And that can be anything from rec centers, libraries, museums, older adult centers. To find out what cooling centers would be near you, if you were unaware of which ones were near you, all you would have to do is just call 311 to figure out where those locations are. If you can't get access to a cooling center, try spending time at the shopping mall or a friend's home or a friend's house to cool in some AC, whether it's for 5 to 10 minutes. A short amount of time in the cool air can always lower our body temperatures, thus making us feel better overall, right? Another alternative that we can essentially use for the summer would be public pools. This summer, Philadelphia will be opening 50 public pools for individuals to have access for swimming this summer. The date will still the date for when that starts is still to be determined. But what will also be offered is some of these pools will also be offering free swimming lessons. So if you have kids, grandkids, nephews, nieces, and they do spend a lot of time within their homes, this is a great way to get them, and they don't know how to swim, this is a great way to get them outside. They can get cool from just swimming, and two, they can also learn something, just learning how to swim to better themselves, and that can be a lifelong lesson just to have in general. And if that is something that you guys were interested in, all you'd have to do is go to phila.gov/ppr to see where those free sessions are offered. And then last but not least, we also have spray grounds. So spray grounds are fun, free, and all over the city for individuals to use. There are 95 sprinklers and spray grounds across the city of Philadelphia. So there's many basically easy access to come across them. And if you were interested in some spray grounds, you can use the link below to figure out to see which spray grounds are near you. All right. So now I have a question for you guys. The question is, it is 92 degrees Fahrenheit and Miss Rose doesn't want to run her AC because her bill will be high. It is very hot inside of her home. What are some ways she can stay cool? I see cooling centers. Yep. Great way. Any other answers? Works for me. So I have a follow-up question. So how will Miss Rose know when it is too hot to stay in her home without AC? Yep, she'll feel disoriented. Run the fan during peak heat hours. Yep. All right, two answers. Okay. Um, two answers, which is still good. Both great answers. Yes. So just certain things, just like let's say if you decided to run that fan because you don't have an AC unit and you feel the hot air is blowing from the outside to the inside, that's letting us know, maybe we should go visit a friend, maybe we should go to a cooling center. Just general things like that. All right. So now we're going to talk a little bit about Artreach. So Artreach provides $2 admissions to over 80 cultural sites in Philadelphia and the Delaware area for individuals who receive public assistance for food or medical benefits. You can find more information at this link or by calling 215-515-6720. Museums are also another great alternative to stay cool. They are free to high school students with their student ID cards. And then there are also some museums that are free for individuals, well, free admissions to individuals who receive EBT or access cards for up to 4 adults, and kids who are under the age of 18 are free. And as you can see, these are the 4 museums that do accept those. All right. So like I previously mentioned earlier about the Philadelphia Corporation for Aging, basically during this is a system that comes into play during times of heat health emergencies. So as I mentioned earlier, it can be a great resource for during heat health emergencies. You can talk with health department nurses about heat related questions. They can help you find cooling centers or other resources that can be beneficial to you, like utility assistance. And just a heads up, because sometimes we do receive this question, the PCA does not provide or does not give out free AC units or fans. And if individuals did need access to an interpreter, we have staff on hand that speak Spanish and Russian for interpretations. And if you did need additional interpretations, we do have a language line that we can connect you to. The heat line is usually open from 8:30 a.m. to 8:30 p.m. and you can check phila.gov for the most up-to-date information and news surroundings. All right. So the PCA also has emergency fundings to help older adults with things like utility assistance, food, medication, glasses, and appliances. The community orgs, social workers, and clergeries can apply on someone's behalf. So if you have a family member who essentially is who essentially is not that tech savvy, you can also assist them with the process. To get a referral form or info sheet, just email the link below at PCA Helpline Supervisors at pcacares.org. We can send copies to your organization if needed. Just let us know. All right. So preventing water shutoffs. You may be able to delay or stop your water shutoff under certain conditions. For the most up-to-date information, you can click on this link at Prevent Water Shutoffs just to see what's the information that's surrounding it. But one of the processes would be applying for assistance. This is just requesting the application, and it gives you a 30-day protection window from your water from being shut off. And then we have request a payment plan. Basically, you can set up a payment plan to pay off your water bill in increments instead of one full lonesome bill if you didn't have the payment in full as of right then and there. We have medical delays. So if you are sick and need water for medical reasons, ask your doctor about a medical delay. It can pause a shutoff for an additional 30 days. And then we have the raise your hand shutoff exemption. This is for any seniors, person with disabilities, or illnesses, or children who live with you. Your home may qualify for a shutoff exemption. All right. So neighborhood energy centers can help residents weatherize their homes, understand utility bills, and connect with assistances and connect with assistance. You can go to or scan the QR code to view the energy neighborhood centers in your areas and see the local hours and what services they provide and resources they provide for individuals. All right. So we talked a lot about the benefits of having a air conditioning unit, but we didn't talk about how costly it can be over the amount of times that we'll use it within a week. So Yusuf Utility Assistance Program, it offers up to $1,500 to help pay your energy bills. If you were if this is something that interests you or you know someone that could benefit from this, you can always contact Yusuf at 215-814-6837 for additional information. You can also scan the QR code on the flyer to fill out the contact form. If you need a stack of flyers to distribute to individuals in the community, just let us know and we can mail them to you. All right. So some additional information that Yusuf provides. It also stabilizes housing for families facing housing crises by addressing their immediate needs, and it removes the barriers to long-term stability. So if you had trouble with case management, financial assistance, getting referrals, even access to resources, Yusuf can help you guys with all of these things, and they're usually open from 8 a.m. to 5 p.m. All right. So we talked a lot about talking to your doctor when it comes to heat illnesses. Everyone needs a doctor you can trust. Don't be afraid to switch doctors until you find the right doctor, right? A lot of times when we go to see our primary physicians, we're going to doctor, right? We're being put in the waiting room for an additional 15. I've been in waiting rooms for like 20 minutes sometimes, honestly, without any interaction besides the nurses that come take your general vitals like blood pressure and things like that, right? Then we see our doctor for maybe 5 minutes, and we don't know if they were looking over our chart for 5 minutes, 10 minutes, or even a minute, right? So just acquainting and familiarizing yourself with a physician that you know, trust, you know, cares, you know that prioritize you guys' time together so you can trust them and you can trust their critique in your general care, right? So it's never feel afraid to switch a doctor or switch your physician to someone you feel like has your best benefits for you. So your primary care provider, your CPN, helps keep you healthy and answers any questions you may have, as little or as big. The website lets you search for doctors by location, languages, and specific specialties. So perfect for those who are uninsured or underserved. All health centers offered phone interpreters if needed, and some have in-person help too. If this is something you're interested in, you can always scan that QR code also. All right. So your mental health and well-being is very important. If you or someone you know is experiencing a mental health crisis, please call 215-685-6440. Interpretation is also available for this. Or for free online behavioral screening and resources, visit healthymindsphilly.org. Another great resources, while it is available, is the Mental Health 911, which is another short-term 3-digit number to memorize for your health and safety, which would be 988. Call or text this number if you or someone you know is going through a crisis or even just needs to talk to someone. A newsletter with mental health and wellness resources will also be provided in a follow-up email for you all. All right. So extreme heat guide. So did you also forget everything? Did you also forget everything we just said today, or just need a quick refresher? No worries. So head to www.philly.gov/heat anytime for the city's extreme heat guide. The site has info on who's at risk, heat safety tips, and printable resources in multiple languages if you can share with your community. And if a heat event is happening, the site will update you with emergency information and relevant blog posts, so you're always in the loop. So here's our summer newsletter. You can order printed copies of our materials in multiple languages with the link above, and they are free and will be printed in color and delivered to your address, or you can come pick them up. All right, so stay connected and stay informed with us. If you ever have any lingering questions or any questions in the future that you wanted to direct directly to outreach unit, you can always contact us at publichealthpreparedness@phila.gov. To stay up to date with with potential emergency crises or emergency crises that may happen or may occur in the Philadelphia area, just make sure you sign up for that Ready Philadelphia text. And you'll text that to 888-777 so you can be in the loop about what's going on in your city. Don't forget to join our Community Response Partner Network, which is our newsletter, just for the most up-to-date information surrounding around the public health department. And thank you all for your time. I'm going to send it back over to Jasmine for her final thoughts.
Thank you, everyone. We really appreciate you joining this training and hope that you can share this information with your community members and other people surrounding you so that they can stay healthy and safe throughout the summer. The earlier you share this information, the healthier people can be before it even gets really, really hot out, which as we saw from our stats earlier, is going to be a little rough. If you have any questions, like King said, please do reach out to us at publichealthpreparedness@phila.gov. This training will be uploaded to our YouTube channel, and we also will be sending out a follow-up email with the slides and all the resources that we talked about today. Thank you.
If you all are still here, I thought you did a great job. Hi. Thank you for interpreting for us.
Yes, thank you so much, Cornell. Really appreciate it. And sorry about the time. Thanks.